recording this session so we can send it over to people who might not be able to attend these sessions. So basically what I wanted to go ahead and do today, I want it to obviously be, very informal, very conversational like, and things like that too. You guys are definitely welcome to turn your camera and video on since we have a smaller group. I think that would definitely be okay in this smaller session and everything. But I will go ahead and kind of talk to you a little bit about just a summary about our clinics and things like that, and then some of the openings that we have right now. And then I'll go ahead and take any questions from you guys about any specific types of positions or anything like that. So yeah, so I guess to get started, so here at Nebraska Medicine, we do have around 40 clinics. So they are based, we have some that are in Iowa. The majority of them are going to be in Omaha. We have one in Bellevue, in Plattsmouth, and then we have also one in Grand Island as well. So we have a lot of different clinics. They kind of are broken into either a specialty clinic, they're either family medicine, primary care, and then we also have our immediate care clinics, which are basically similar to urgent care. Those types of clinics are open after hours, and kind of the same concept as I mentioned as an urgent care, from like 6 p.m. to 10 for, after if anything would happen and the doctor isn't open. So we have those as well. Just some of the different positions that I currently have available right now. So mainly what I recruit for, kind of like my bread and butter, if you will, is going to be clinic nurse positions. So I do get to work with Shanda a lot for different clinic nurse positions that she has, as well as a lot of other great clinic managers. I also recruit for our case manager positions, clinical program coordinator positions, nursing care coordinator, and then I think the other one that I wanted to touch on, we have an ambulatory supervisor position right now that I'll touch on a little bit, and then a few staff nurse positions that I technically recruit for that would be kind of more in the clinic setting, if that makes sense. So for example, our infusion treatment center, I have some of those positions, as well as apheresis too. So I guess to start, does anyone have any questions for me just off the bat that I could answer? Perfect. Well, I will go ahead and so some of the open positions that I have open right now, I'll kind of just touch on them and go through some of the different, I guess, components of the position. So I'll also let Shanda talk to this as well, but for a clinic nurse position, kind of how I like to describe the clinic nurse position is going to be, someone who's going to help out with, scheduling, there's triage, medication refill, a lot of those types of job duties in our clinics that are obviously very important for them to, keep running and everything like that too. So for clinic nurse positions right now anyway, and we have new jobs that post all the time. So you'll see kind of a, if there's like a certain specialty that you're looking for, things like that, let me know. And, we can always work together to let you know how often I see those types of jobs and things like that. But for right now, what we have open for clinic nurse positions, I have one that's going to be in cardiology. So this is going to be at our Durham Outpatient Center Heart Center Clinic for cardiology. So definitely a more specialized one. And then I also have employee health. So a little bit about employee health. So anyone who starts here at Nebraska Medicine does go through employee health. So these nurses talk to a lot of different people, basically everyone that we're hiring, and then as well as our current staff members. So as you can imagine, during the pandemic, they have been very busy with different things going on, with checking in with our current employees who may or may not have COVID and are trying to get back to work, that type of thing. So we have a few openings for them right now to definitely help out with just the volume that we've been seeing. So we don't usually see a ton of employee health positions just because it's kind of one of those niche jobs that once you're in that role, people stay in that role for a long time, just because I think that obviously we have a really good manager in that one, and it's just people feel comfortable staying there and everything too. So that's definitely one to look out for on our website. Another clinic nurse position I have that's also more of a unique one is going to be at our Trulson Eye Institute. So definitely another very specialty one as well, but Trulson Eye Institute has been, can't remember specifically when it opened for sure, but definitely within maybe the last like 5 years or something, I think maybe. They opened the new area outside of, it's technically still located on main campus, but it's just a little bit south. And it's a beautiful building if you haven't been there yet, but they also have a clinic nurse opening position there right now. In general, I guess I should mention, so most clinic nurse positions with that job title are going to be, Monday through Friday, 8 to 5, no weekends, no holidays, that type of thing. So, it can be very appealing for someone who is either, has a family life, looking for more family life balance, something like that, or just maybe doesn't want to work the long 12-hour shifts as well. So a couple different components for that. Some of the other positions that I wanted to touch on. So I do have 2 case manager positions as well. So a case manager position is definitely not more of an entry-level position by any means, but it's a important position that gets to work with patients specifically and the provider to work on their plan of care and things like that too. So obviously a very important role. The one that I have right now that's full-time is going to be for surgical oncology. And then I do also have one that is a PRN position that is for oncology as well, but not surgical. So there's 2 of those available right now. And then probably one of my favorite roles to recruit for, I don't know if I should say I have a favorite role to recruit for, but a nursing care coordinator role. It's something that's newer to Nebraska medicine. It's kind of a hybrid position between a clinic nurse and a case manager is how I like to describe it. So it does start out with, you do have some of those job duties, like I mentioned, like the triage, medication refill, scheduling, but then you of course have some of the kind of job duties that a case manager does with, really working with that coordination of care with patients and the providers and things like that too. So it's, like I mentioned, it's probably one of my favorite positions to recruit for, because a lot of the time it's people who are kind of looking to, take a step up in their career, or it's kind of like that first stepping stone. And it's obviously a very important position as well. So for those right now, I have our Midtown Clinic, which is a primary care clinic. We have one of those opening right now. And then the other one I have is for radiology. So this is actually a new position. The radiology team has never had a nursing care coordinator position before. So it was nice to get to talk to the manager for this position, let him know kind of the, usually how the candidates that we get for nursing care coordinator positions and things like that. So we have one of those for radiology for a new position. And then a few other things I just wanted to touch on. Definitely, again, if you guys have questions, feel free to jump in. But I have an ambulatory supervisor position. So that's probably another one of my favorite positions to recruit for as well, just again, because I'm getting to talk to candidates who are looking to kind of take a step up in their career as well. So those are, if you haven't noticed, kind of a trend with some of my favorite positions. But an ambulatory supervisor position would be a step below the clinic manager. So Shonda, how many do you have for ambulatory supervisors right now?
Currently, I am in transparency because we believe in that Nebraska medicine. I have 2 leads, but I am working with my director to turn the 2 lead positions to 1 supervisor, because with the clinic of the size that I have, that would be useful and not as overwhelming for the leads as we've transitioned to being more busier and different things that are required, in ambulatory.
Okay.
Yeah. So for a clinic of my size that I have 5 specialties, and I can get into those if you want me to.
Yeah, let's go ahead.
Okay. So for my clinic, I have nephrology, gastroenterology, pulmonary, allergy, infectious disease, which is a hot topic right now, as well as rheumatology. And each of those specialties at some point can have transplant involved in them in helping in either the evaluation process, medical management, or post-transplant for whatever reason. So while it's 5 or 6 specialties, each of them have their subspecialties, and with those subspecialties and the primary specialty, we have probably about 30 clinics in total that I would say run in our one area. So, it's a very busy place.
Busy.
So for each specialty, we have a group and a team of nurses, clinic nurses, that take care of those patients. So again, when you think about how busy that is and how big it is, infectious disease is is one of my leads. Pulmonary is one of my leads. With all things COVID right now, they are extremely busy and overwhelmed with patient care. So trying to pull them in to help with leadership items is kind of difficult. They manage it and they do a very good job. But for me, when you think about how big that is, a supervisor would be a lot more beneficial. So be on the
Sure.
look for that soon. Um,
All right.
the request that I'll be asking for. So I would say, you want me to talk about how the clinic nurses are
Yeah,
in my
let's do
area?
it.
So most recently, I just hired for a pulmonary nurse who was going to focus on sleep medicine. Sleep medicine, when people hear that, they automatically think about sleep apnea, but it's more than that. It's also your ALS patients or any patients that would have any type of condition that would potentially affect their lungs, their sleeping progress, breathing. They are evaluated by sleep medicine. And again, even the transplant patients are. So I just hired for that one. And then I also at one point had an allergy nurse position
Mhm.
open. And for all of the nurses, I would say no matter which specialty it is, the way that it's transitioning, the clinic nurse is no longer what most think the clinic nurse is. The clinic nurse is not only doing the behind the scenes of refills, triage, working with the patients in between patients, but they're involved in clinic. They're working with the physician on communication of different procedures or what are the next steps for the patients. So really a position that's really focused on building relationships. I would say that it's a position that you, like inpatient nursing, you can turn it off, right? You give your report, you leave for your shift. When you come back, you may or may not have the same patients. For ambulatory, you're going to have those patients. They're your babies per
I
se.
like that aspect of it too.
Yeah, and most people really love that because they get to know their patients. You build relationships. I would say the biggest thing for people is just to learn how to turn that off. So you have to be able to manage your day and know, okay, am I at a safe point? It's 5 o'clock. It's the end of the day. Am I at a safe point to just make a list of what I need to address quickly the next day so that I can get out of here? Because ambulatory, you could work 24 hours a day, so you have to know how to cut that off and then where to start the next day and just be flexible. With the pandemic, everyone had to pivot and do a lot of things differently, start getting involved in televideo visits, getting involved in telephone visits and triage
Yeah.
those that the physicians may not be able to see. And it's really opened up access, for the
Mhm.
patients and for the nurses to be able to do teaching where the patients who are nervous about coming into the environment, which I will say for you all, the hospital is one of the safest places to be because everybody's doing the same thing. Everyone's wearing a mask. We're all wearing goggles and taking those safety precautions to protect not only the staff, but the patients that come into our environment. So I really enjoy being in ambulatory. You get to meet a lot of people who come in really sick, and then by the time we're done, they're doing really well. And even for those that may not get the best prognosis or outcomes, again, you've built that relationship and you get to really sit and take your time and hear them, what their concerns are and support them in whatever their next step in their journey be, whether it is going to be its end of life or there's nothing more we can do, or guess what? You came in pretty ill and now you're ready to move on to life and live again. So,
I love it. Perfect. That's awesome. Thank you so much for sharing that. That's very helpful.
uh-huh.
I like your insight on it because you obviously get to see it every day and everything. So that's awesome. I guess we have about 5 more minutes here in this, or wait, sorry. We actually have, we have 10, or we still have some time basically. So a few other things that I just wanted to go ahead and address. So kind of like Shona mentioned about her soon might be getting an ambulatory supervisor position. So just a little bit about ambulatory supervisor positions as well. So that is another thing that, similar to the nursing care coordinator role, is something that's kind of shifted into a newer position within the last couple of years. And again, it's a position I get excited for because it, again, is that, kind of first step into leadership, which I know a lot of people are looking to get into as well. So for an ambulatory supervisor position, like I mentioned, it's a step below the clinic manager, and then you do get direct reports for these roles as well. So, you could have, it probably, I mean, it depends on the clinic and everything, but you could average around maybe 15, other staff members that would be under you. And, it really is a leadership type position too. So most of them are kind of a working role where you would still have some of the, clinic job duties to help and jump in and as needed and everything too. But then, you get to help with either, staff issues that are coming up or, just kind of the operation of the clinic and things like that too. So those are really great positions to look out for if it's something that you are interested in wanting to get involved in leadership. Like I mentioned, we have a question here. Perfect. Okay, so I saw your question. Thanks, Eleanor. So that's a great question. So right now at this time, I do not have any clinic nurse positions that are in women's health. As you can imagine, when we do have those positions, a lot of people do apply to those quite a bit. So those are definitely ones that if you do see, it would be at our Olson Clinic is what it's called, is our women's clinic here on our main campus, to look out for the women's health. And then I would always recommend if you see those positions, apply right away, just because, with women's health, a lot of people do, apply to those types of positions. So they do get a lot of applicants. So as soon as you can get your application in, the better, because a lot of the times we'll have to close those after a few days just with the amount of candidates that we get. So not right now, but keep your eyes out for it for sure. Great question. Thank you for asking. And then let's see. Perfect. Okay, so the other two that, again, so we chatted about the ambulatory supervisor, case managers, clinic nurses, nursing care coordinators, and then so just a little bit about the staff nurse positions too. So for staff nurse positions, so it's kind of weird sometimes when I have those types of positions, just because they kind of fall more under ambulatory than they do, really working inpatient. So for example, when I have like the infusion center positions, you're working with about 70% of like oncology patients and helping them through their treatments and things like that. So the hours are kind of more standard for those around. It could vary a little bit, but more days hours for those type of positions. The other staff nurse position I did this one posted a few days ago is for wound and ostomy. So that one is definitely a specialty one as well. I know not everyone is always super interested in wound, or it's kind of the opposite. They love wound. So I always see kind of both sides of that for those, for wound and ostomy. And then apheresis. So another one that does have a big focal point on oncology and everything like that too, but they get hooked up to machines and go through apheresis and things like that. So that is just kind of a breakdown and everything of the current openings I have right now for all the different specialties. Obviously, we do get new jobs posted every week, sometimes every day. It just kind of depends. But what questions can I answer for any of you guys? It can be about open positions. It can be about the recruitment process, anything. I'm open to whatever you guys have. You can either use the chat function below, like Eleanor did, or you're welcome to join on your microphone too.
And don't be shy. I will say that if there's a question that you have, no matter what it is, somebody else may have the same question and they just don't have what we have at Nebraska Medicine. One of our values, courage to say it because you're a little shy, but go ahead and speak up. That's what this time is for.
Yeah, yep. So we have about 10 minutes for questions, basically. All right, perfect. Thank you. I see questions coming in. Okay, awesome. So you did ask, I don't know if you guys can see those questions too, but do we hire new grads in clinics? So this depends. A lot of our clinic nurse positions are going to want, basically nurses who have been a nurse for a couple of years at least. So let's, okay, we just got a reminder, 10 minutes, but okay. Anyway, so sometimes they do. So basically, it's the best way to kind of figure out if a position is one that's going to look for experienced nurses or new grads is just to go ahead and you can reach out to me directly. I would say that like our Trulson Eye Institute is one that is open to new grads. Yep, her clinic, definitely. She doesn't have anything open right now, but she may. So look out for that as well for internal medicine. And then I'm trying to think about what else. Our dermatology clinic. So we did just recently have those posted as well for dermatology. And those are also new grad friendly as well. I think kind of with dermatology and similar to a lot of different clinics, when it's so specialized, sometimes you don't have a lot of people who have that, either knowledge or have done that role before. So, we're definitely open to training anyone for those types of positions. So yes, we do have some that do allow new grads for sure. And then so the next question was, what hours for the nursing care coordinator position? So this is going to be an exempt salary position. It's a 1.0 FTE, which means that it would be 80 hours every 2 weeks. And then it is going to be that same, like Monday through Friday, 8 to 5, no weekends, no holidays. So sometimes you may work hours outside of that, of course, since it is an exempt position and things like that, but general Monday through Friday, 8 to 5. And then Kara asked, does ambulatory surgery fall under clinics? If so, if there are any openings. So no, so I don't specifically have anything for anything that would be under surgery before. So that does fall under the staff nurse title. So like our, probably gonna say it wrong, but like should help me out here. Is it like the Fritz? Do you know what I'm talking about? The surgery center that's by LOC?
The Fritz. Mm-hmm.
Fritz. Okay, that's what I was thought that is called. So those ones do have, that's where a lot of the surgery would fall under those staff nurse positions there, or at Village Point. I know they also have a surgery clinic there. So nothing specifically that would be titled clinic nurse, if that makes sense. What other questions? Thank you for everyone who asked questions too. I really appreciate it. Perfect. Okay, thank you guys for asking more questions. Okay, so Kara asked what benefits and pay are like for a clinic nurse. So that's a great question. So benefits, definitely I can kind of go over in general. This does pertain to basically all Nebraska medicine positions for nursing anyway. So it's not just specific to clinic nurse, but for benefits, we do have 3 different healthcare plans that you can choose from for health insurance. And then we also offer dental and then vision insurance as well. For PTO, you'll start accruing 6.15 hours of PTO per pay period for paid time off that you can utilize. A couple nice things about that. So it's about 20 days per year is what that amounts to starting out. And then the longer you're with Nebraska medicine, the more it increases. And then you do start accruing it right away as well. So I think that's, I've worked for some companies before where we have to wait like a month or 3 months or something like that. So it's nice that you can start accruing right away. We also have a 403B for our retirement account. And then we go through a company called Credential for retirement. And then, yes, I can definitely touch on pay. So at Nebraska Medicine, basically blanket statement, any of our jobs go off of years of experience and then education. So those are kind of the 2 components that we look in. So it's very individualized. So it's not just like we have, a clinic nurse and they all make the same or anything like that. It's very individualized to the amount of years of experience they have. I will say, I'll be honest, so it is a clinic nurse position is going to be a pay grade lower than what like a staff nurse position would be. Obviously, it's just a little bit different because of, the hours a clinic nurse is working, again, Monday through Friday, 8 to 5, no weekends, no holidays, that type of thing. And then obviously the acuity of patients as well. So bedside where you're, maybe working with stronger acuity patients, things like that, has a little bit difference for the pay. Now, starting out, a clinic nurse, so say we did hire a new grad, it would start around $24 an hour and then 50 cents, and then increases there with years of experience. So obviously, I know that a lot of clinic nurses are ones that have experience. So I know that minimum sometimes can seem kind of daunting to them because they've been a nurse for so many years. So again, I just want to let you know, it does go off years of experience. So that's just like the bare minimum for that position as well, and then increases there. And then, so that's for a clinic nurse, I should mention. So a nursing care coordinator position is a couple pay grades higher than what that is. As mentioned, that's in a salaried exempt position. That one requires 2 years of nursing experience prior to applying for that. an ambulatory supervisor position also is going to be the same pay grade as a nursing care coordinator. Excuse me. Again, it requires 2 years of experience to apply for those. Also an exempt position. And then a case manager position is also an exempt position, still that same hours, Monday through Friday, and then would even be a pay grade above a nursing care coordinator position. So that one, I believe, requires 3 years of prior nursing experience too. So just to kind of give you a rundown on some of those in general. And then Cindy asked any float or PRN clinic positions. So that's a good question. So most of the time, actually, I've never seen a float clinic nurse position before. I know sometimes they do float to help out, but it's not an official position, I guess, if that makes sense. Reason being, obviously we have primary care, we have specialty, lots of different family medicine. So sometimes it's very specialized. So it can be hard for someone to float to all the different specialties. The clinics can be run differently. Go ahead.
Yeah, I was just going to say what most clinics will do, if you see it's a PRN position, it'll be within that clinic. We don't have per se a float pool, but each clinic, like I did at one point, have a casual nurse position. I will utilize that nurse to help whatever specialty needs help. So those would be within the clinic, but not per se a pool that people go to different areas.
Yeah,
to
that's a good way to put it. Yeah. And then as far as PRN goes, so as you mentioned, that can definitely be one option if you see. In general, I do not see a lot of PRN positions. I would say probably one of the most common that I would see would be for the immediate care clinics. So those hours are going to be not the 8 to 5. Those are, it's like 6 p.m. to 10:30, I think, p.m. So just with the nature of the hours and everything like that, it does, those positions for PRN are a lot more appealing to people if they can just pick up shifts here and there for that type of thing. Other than that, I'll be honest, I do not see a ton of other PRN positions that I can think of besides that. So not a ton. Most are that Monday through Friday. A few, I would say even a couple during the year will have some that are part-time, but again, not that often that we have part-time too. The majority would be that Monday through Friday. So perfect. Thank you for answering or asking questions too. So I think we have about 1 minute. So I just wanted to thank you guys so much. Shonda, do you have anything to say?
Yeah. Thanks, everybody. We appreciate you considering ambulatory, and know the benefit is a 40-hour work week, no weekends, no holidays. Yes.
And you could potentially work with both of us. So, but yeah, so thank you so much. And I appreciate you guys asking questions. We'll kind of go in the next session, or in the main session, they'll talk more about the application process and things like that too. So to be on the lookout for that, and definitely feel free to reach out to me if you guys have questions. But yeah, we'll get ready to go back into the main session, and Shonda gets to talk more about her experience at Nebraska Medicine too. So I'm really excited to hear it. Thank you guys.
Welcome back. Hope you guys enjoyed your little breakout rooms. I'm going to go ahead and share my screen again. While I'm sharing my screen, if you guys want to type in the chat function what your favorite thing was about your breakout room, or maybe what you learned that you weren't expecting to learn, we would love to read those comments. Okay, so Sue, if you're ready to go, we can definitely get started with you, and then you can announce your winner and all that.
I'm going to announce my winner at the end of my session, if that's okay.
Perfect.
Okay, so good morning, everyone. Welcome to Nebraska Medicine's first virtual open house. Thank you for joining us on this little dreary Saturday morning, but thank you for being innovative with us. It's kind of fun to do. I love to see the breakouts when everybody comes back. It's really kind of cool. So I'm just going to take a few minutes to talk a little bit about Nebraska medicine nursing, and a little bit about my story. Next slide, please, Erin. So not sure if you're aware, but 2020 was named the year of the nurse and the midwife. And we celebrated this in nursing forums in January at Nebraska Medicine, just as COVID was starting. And who would have thought, any of us, who would have thought that the year of 2020 would have so much for nursing? It's been a very unique year. It's been an unprecedented year, but how wonderful the opportunities that all of us as nurses have had during this year. Next slide, Erin, please. Here are some of our COVID unit staff members. Just wanted to share some pictures so you can see some of our colleagues. And so let me tell you a little bit about Nebraska Medicine. So in the Metro Omaha area, we have 3 main campuses. We have the main campus that most people will think about at 42nd Street between, well, now it's between Dodge and Leavenworth, really. It's on the same campus as UNMC. But we also have Village Point out at about 168th to 180th and just by Village Point Shopping Center. And then we also have our Bellevue campus. We have 2 hospitals. One is called Nebraska Medical Center, which is the main campus one at 42nd Street. But then we also have a hospital inpatient tower at Bellevue Medical Center, which is on 370, just off of Highway 75. We have more than 800 licensed beds across the 2 inpatient hospitals. But we have care that extends across the region. We actually have about 40 specialty and primary care health centers, and we actually have clinics in Lincoln at the health center on UNL's campus, and also out in Grand Island. So you can see that our footprint is starting to spread across the state and not just in Omaha proper. We have more than 1,000 physicians. We have more than 8,000 employees, and our promise is serious medicine, extraordinary care. Next slide, please, Erin. This is one view of our main campus. You can see that it kind of continues to expand. Next slide, please. This is a picture of our Bellevue Medical Center campus, again, right on 370. Next, please. And this is our Village Point, just a shot of our Village Point. So you can see that we do spread across the city. Next slide. So let me tell you a little bit about Nebraska Medicine Nursing. We have over 2,500 nurses across the organization. And between our 2 hospitals, we have 25 inpatient units, critical care, progressive care, med-surg, pediatrics, PICU and NICU, and also women's services. You can tell from your breakouts that we have oncology, heart and vascular, solid organ transplant, trauma, neurosciences, orthopedics, just to name a few. We also currently have 3 units that are dedicated as COVID units so that we can have a place for patients to go, especially if we have an upsurge with COVID moving forward, especially when flu season starts. We do have 4 surgical or procedural locations. We have 3 infusion centers, and we have 2 emergency departments, and very soon we will be having a psych emergency services emergency room type unit that will open very, very soon. I'm not going to say the date just in case, but it's very, very soon. But the other thing I want you to know about is that we are a magnet organization, which I think is very important. Next slide. Here's a group of our ambulatory folks. This is from our dermatology clinic. This was early on in COVID. And you can see our shirts, UNMC and Nebraska Medicine Strong, which has been our motto throughout all of COVID. Next slide, please. So I'm not sure how much you have learned about magnets in school, but I want to share with you what's the benefit of a magnet program in a hospital that's magnet designated. Basically, hospitals that have the magnet designation recruit and retain top talent, hopefully recruiting all of you that are on the call today. But magnet hospitals also improve clinical outcomes for patients. There also is an improvement in satisfaction, both nursing and patient. Magnet hospitals foster a collaborative culture. So we have interdisciplinary teams that work together to care for our patients and to make improvements. We also, magnet designated hospitals, advance nursing standards and practice. We're innovative and we listen to the nurses, and if they think of something that we think could be done better, we work with the nurses to make improvements. Magnet hospitals also help to grow the business and financial success of the hospitals. Next one, please. Here's some more of our team members. I'm going to try and read it. I had notes, but I forgot to write them down. Okay, it says, I am a nurse. I'm not going to be able to read it. Basically, this was our 9 trauma team that did this during COVID. When COVID first hit, we were very innovative, or we were very energized and had a lot of adrenaline rushing through us. And then as we realized that COVID was going to carry on and on and on, it's kind of made us it's pulled us down a little bit. So the 9 trauma team put this together just as a pick-me-up. And I'm sorry that I can't read all the signs, but it's just a very nice, it basically talks about, I care for you, I care for your family, we're here for you, and we are Nebraska Medicine Strong. So, okay, next slide. So here's my story. I'm 58 years old. I was born in New Jersey, but I've lived in Omaha for almost 25 years. I've been married to my husband, Joe, for 32 years. We just celebrated our anniversary on Thursday, but I've actually known him since 6th grade, so known him a long time. We have one son, Josh. He is 26, and he currently lives in New Jersey. And most of our extended family is in the New Jersey, New York area. Next slide. This is us. We are diehard Notre Dame fans. We are very sad that football season is kind of strange this year, and that the Notre Dame football team has had COVID for 2 weeks now, so we're not even able to watch on TV. Normally we go once a year, and actually we were supposed to go to Ireland to see the Notre Dame Navy game in Ireland this year, but we couldn't go. So anyway, that's us. But here's my professional story. I've been a nurse since 1982, so quite a long time. I started out with an associate degree that I actually got from UNMC in 1982. But then my father, who worked for an oil company, had been transferred a couple times. So I moved to Syracuse and got a bachelor's in Syracuse in 1984. I then worked on a general pediatric unit for a couple of years in Albany, New York. And then I really thought that I wanted to teach in a college of nursing. So I went back to New Jersey and got my master's at Seton Hall. But instead of teaching, I became a nurse practitioner, and I worked as a nurse practitioner in a pediatric oncology clinic for for about 8 years before we moved to Omaha. And then again, I thought I wanted to teach in a college of nursing again, so I got my PhD in 2007, but every time I go back to school, I find myself still wanting to stay in the clinical arena. So hence why I have not gone to a college of nursing just quite yet. When I had the opportunity to become the chief nursing officer at Nebraska Medicine, I realized that my first degrees were great in nursing and gave me a great solid foundation for nursing education, but healthcare is a business. And so I decided that I needed to get my MBA so I could have a better understanding of the business aspect of healthcare. So I got an MBA in 2017. Most of my experience has been in pediatric oncology, and I've been in leadership for 13 years, and I've been the chief nursing officer for 6 years. One fun fact is that I did not pass state boards the first time. And if you were to ask the faculty in the associate degree program at UNMC in the early 80s, if I would have ever aspired to be a chief nursing officer, they would have laughed at you because I was a really bad student. But I tell you this because look where I am now. So just one bump in the road doesn't really matter, right? You will hear in the next hour or so from 2 of our managers. One is going to share her journey at Nebraska Medicine. That's Shonda Ross, and she, I believe, follows me. And then later on, you'll hear from Kaylee Guinan, who is a manager over our nursing professional development specialists, basically our nurse educators. And you're going to hear about our nurse residency program. And I would suggest that you really do pay attention to what they have to say about the nurse residency program. Recently, I talked to one of our newer nurses who came from another system. And so she's an experienced nurse, but she's newer to Nebraska Medicine. And she shared that she wishes she would have had a nurse residency program in the location where she started right out of school, because she said it's amazing how much support a nurse residency program has for new nurses. So that's the end of my story. I wanted to thank you again for joining. Oh, sorry, here's another picture. Oh, there's Shonda Ross. She's the one in the far left. So you're going to hear from her in a minute. That's her clinic team, just being Nebraska Medicine Strong. And again, I want to thank you. I hope that you're getting some good information. Would love for you to choose Nebraska Medicine. It's a great place. There's a lot of things to do. We care for newborns, even preemies, up to elderly people and death and everything in between. And so it's a great place to work. With that said, I am going to announce the winner of the gift card is Bridget Geary. So Bridget, I don't know where you are, but thank you for joining us today and congratulations to you. And I'm going to stay on to hear Shonda's talk, and then I do have to jump off. So thank you all again. Thanks to the recruitment team. They put a lot of time and effort into this, especially figuring out the breakout room. So thank you all and have a wonderful day.
Thank you.
Thanks so much, Sue, and congrats, Bridget. We will email you probably Monday and get that gift card over to you. So you are the proud new owner of a $50 Amazon gift card. Yay! So up next, we are going to hear from our clinic, or one of our clinic nurse managers, and that is Shonda Ross. So she doesn't have slides, but I will just leave this screen up, and she is just going to kind of present at free will. So have at it.
All right. Good morning, everybody. This is what I do best. I do best at juggling and, not having things in front of me. So if you haven't heard, in the news this week, we had things happen at Nebraska Medicine as far as our electronic system. So I couldn't get to my drive to create the fancy slides like Sue. I'm sure Sue was already prepared weeks ago. So
I just did it the other day.
But I didn't have an opportunity to have slides for you. So hopefully I will entertain you with my conversation as well. So I am Shonda Ross. I am a clinic manager at Nebraska Medicine. I am coming upon my 22-year anniversary at Nebraska Medicine. So for me, I am an Omaha native, born and raised here, although you may hear a little bit of a Southern twang. That is my family background. So I visited the South every year for the summer, so it just kind of stuck. And down there I talk proper, up here I talk country. So here I am. Married to my high school sweetheart. We have been married now for 25 years, have been together for 34. Wow. We have 3 children, 2 grandchildren, 2 little girls, and then 1 grand dog. My youngest is attending Iowa State. She does not like children, so she decided that she would get a dog right now in her life, at this stage in her life. I have obtained my bachelor's degree at Methodist, and I obtained my master's degree at Clarkson that I did have the opportunity to obtain, I will say, with minimal financial cost to me, because I was very blessed at Nebraska Medicine. We do have a tuition reimbursement program, so that allowed me to be able to get my master's degree without having a lot of financial obligation on my plate. So I will say that I always wanted to, while we are called Nebraska Medicine, when I first got into nursing, it was Clarkson. And I always wanted to work at Clarkson since I was a little girl. I knew I wanted to be a nurse at 5 years old. My mother has always had health issues, and I was just considered indeed her healthcare person. I knew how to take her blood sugar. I knew how to give her insulin. I knew how to call the rescue squad when I needed to. So a lot of responsibilities for little shoulders, but I took it on and I loved doing it. So I told her that I was going to be a nurse so that I could take care of her for the rest of her life. So when I was at Methodist, of course, they were recruiting their own students, but there became an opportunity where we could come to Clarkson College to get what they called an internship the summer before graduation. I took advantage of that internship, was able to work on our 6th floor, which was at that time called subacute rehab, where patients who weren't quite ready to go home and still needed some nursing care, they came to that unit. So it was a mixture of rehab and med-surg. I was there for the first part of my career, and then from there, opportunity. And by the way, I got hired before I graduated. So talk about pressure. I really needed to make sure I passed them boards. So thank God I did. I had a job ready and waiting. I was on that unit for a while. We went through some changes. I went through one of the first mergers for Nebraska Medicine and UNMC coming together. And then we did another change in our unit that changed it over to a neuro unit. Wasn't quite my cup of tea. I was at that time what we would call a cares nurse, and the cares nurses would work the weekends, from Friday, Saturday, Sunday, or Saturday, Sunday, Monday. And so we would float to all the different areas. At that time, I was ready to get my master's degree. I think I was probably 5 years in. Part of that requirement, though, for nurse anesthesiology, which is what I thought I wanted to do, did not think that it was going to be leadership like what Sue was saying. I said, manager, no. Bedside nursing is all I ever thought about, right? So I transferred to the unit, and I had a few things occur personally in my life. My mom got really ill. She had been a transplant patient. I didn't mention that. My brother was able to donate a kidney to her. She had a fall and ended up in our unit, so I had to take some time off. In the midst of that, she got really ill. I'm so thankful to my manager at that time, Chad, who was on that time and took time off and worked with me with my schedule. Then my mom ended up dying in the midst of that. I ended up hurting my back. I had to take time off of work. So then I was told from Chad and HR, due to the restrictions, that I could not come back and be a bedside nurse. To this day, that chokes me up because it was something I was really passionate about and I enjoyed. Had not thought about doing anything else. And my physician and HR said to me, there's a lot of opportunities in nursing that are outside of bedside. You just hadn't thought about them. So I started off in one area, changed my thought and thinking. Master's and degree was then going to change the leadership because I had been encouraged that I had what it takes to be a great leader and they would really like to grow me. So from there, I went into a lead position in our transplant clinic. And then from there, my management career, once I got done with my master's degree, just continued to climb. I was a manager, and then I'm trying to keep track of time, y'all, because I didn't write my slides, so I want to be respectful of that time. As a manager, I then had the opportunity to grow, learn new things. An opportunity came open for me to help out another area, which is our bariatrics clinic. So I had our multi-organ transplant clinic. I was the interim for our bariatrics clinic. Things were working really well. They decided to have me take on both of those under my wing. From there, our director for our program, which that clinic was up under transplant as well, opened up. Our director decided she was going to retire. So I took the courage, I applied for it. From there, I received the opportunity to become the director. And being the director, I also still had my position for being the manager open. So I was kind of multitasking. Things took place as they did with financial in the world, and Nebraska medicine needed to make a decision to pivot. I am proud to say that we pivot really well. When we need to make adjustments to things, we do. And so as a nurse at Nebraska medicine, the expectation is that we pivot as well. So I had a conversation with Sue, who had been mentoring me as I was new to being a director, and my VP, to say that things needed to change. We made some shift and changes in leadership. So there needed to be a shift and change in my position. So moved on from being a director and was told that this is not anything that you did wrong. This is just what we need to do. And we actually need your experience over in this clinic, which is a pretty big ship to run. And we just have not had the opportunity to do it. So we would like you to take this opportunity to continue to grow, to continue to learn, and run this other area because you're really good at building teams, you're really good at building relationships, and helping get things in order of where they need to be. So that is the seat I sit in now as the Internal Medicine Specialties Clinic. So I will say at Nebraska Medicine, you can go and grow in whatever direction you want. You know, as Sue said with her boards, her bump in the road was not passing the first times. My bump in the road was, I'm a director, and now you're coming to me and tell me that I got to move back over to a manager. Moment. But it's a fun fact now because I actually have learned a lot more things. I've had the opportunity to continue to grow and learn, and I'm not done. I'm still looking. We have awesome opportunities at Nebraska Medicine. You're always encouraged to go and grow. You can have mentors from other nurses. You can have mentors from people in other departments. It's just really up to you. So you can come in and it can just be a job, or you can come in and it can truly be a career path in somewhere that you can grow as a person. I'm very passionate about diversity, equality, and inclusion. So Sue and everyone has allowed me to really grow in that department also. Y'all see I'm passionate, I talk with my hands. So just want to welcome you all. I hope you consider coming back to Nebraska Medicine. If you have any questions for me, feel free to jump in and ask or reach out to a recruiter and let them know.
Thanks, Shanda. That was great. So I will give you the name of your gift card winner at the end or during the breakout session too, and you can announce them right after that. So that will be super exciting. I want to point out the fact that she really highlighted growth within the company and all the different opportunities. So even if you start here as a patient care tech while you're working on getting that nursing degree, there's just so much room for growth, and you really can make it a career. I guess I did a poor job of introducing myself this morning. So I am a sourcer on the talent acquisition team. And a really neat thing about my job is that I get to learn about all of the different positions in Nebraska medicine. So you're always encouraged to reach out to me and say, you know, I'm ready for a change. I'm ready for something new. What are the opportunities out there? And I would definitely be more than happy to have that conversation with you and to really work on your professional career growth as well. So you can have a cool story like Shanda and Sue and all the rest of the awesome Nebraska medicine staff. So we are a little bit ahead of schedule, but Tara, if you are ready, we could go ahead and jump into our breakout session number 2.
Once again, if I send everyone to rooms and you remain in the main session, just hold on and I will send you to your room. But I think we should be good this time, so I will send you there now.
People will be joining. Okay, well, I can definitely get started. We had about 10 people in the last one, so I'm not sure if more people will still join or not, but we might just have more of a intimate conversation if that's okay. So guys, my name is Christy Hammer. I'm a recruiter here at Nebraska Medicine. I have been at Nebraska Medicine for almost 2 years and then have been recruiting for our ambulatory setting the whole time. So it's definitely something I've been super passionate about. I've also had the opportunity to recruit for like our allied positions. I also do our APPs. And then have had just kind of some random one-offs, but definitely the ambulatory setting is kind of where my heart is. So it's my favorite thing to recruit for. So I guess are both of you did you mean to be in the clinic nurse session and everything? Are we good? Okay, perfect. Well, good. So I just wanted to go.
Yes.
Okay, thank you. Perfect. So I mean, definitely Phil, since there are just the two of you guys, if you guys want to be on camera, you can unmute if you want, since it's just a smaller session. So we can ask more questions and it can be kind of as, we can kind of go whatever direction you guys are wanting to go in. I have a couple of things to cover and everything, but any initial questions for me that I can answer for you off the bat?
How many different clinics do you cover? Like how many different clinics are there?
So there's almost 40 clinics. So there's a lot. And then, so we also most of them are going to be in the Omaha metro area, but we do have some that are in Iowa. We have one that's in Plattsmouth, Nebraska, Grand Island, Nebraska. So kind of all over, but a lot of it is going to be in the Omaha metro and everything too. So yeah, there are just about 40 clinics that we have, and that does include like primary care, family medicine, the specialty clinics, and then the immediate care clinics as well. So the immediate care clinics, those are kind of different than a regular clinic position because they are kind of like an urgent care. So regular clinic is typically going to be open like 8 to 5. The immediate care clinics are going to be open from like 6 p.m. to I think 10:30 p.m. Just kind of like an urgent care would be, and can definitely, those ones are kind of nice because they are often located in our daytime clinics. So for example, I live out in Southwest Omaha by Chalco. So 168th and Giles, we have a Nebraska Medicine clinic there. That is a primary care clinic during the day. And then at 6 o'clock, it turns into an immediate care clinic. So same location, but completely different staff, different managers, things like that as well. So they just use the location to kind of service that population of patients for, random accidents that could happen and things like that, or just wasn't able to get into the doctor, that type of stuff. So so we have all of those in the different areas. So what I'll go ahead and go over today is the different roles that I currently have open, just a highlight of a lot of the ones that I see a lot of that may not be open right now, but to look out for. Growth within the positions and things like that at Nebraska Medicine, and then I'll touch on our benefits as well. So again, since there's only 2 of you, definitely feel free to just holler whenever or interrupt me. I don't want to bore you with all the information or anything like that. So if you want me to gear it towards something different, we definitely can too. So thank you for joining me on this session though. I'm excited to have you guys. So perfect. So to start, I'll talk about some of our open jobs, and I'll touch on kind of, like I mentioned, like the growth aspect of it. So for the job titles that are going to be clinic nurse, I currently have 3 openings right now. So right now I have cardiology, which is going to be in our Durham Outpatient Center heart center clinic for that one. I have employee health, and then our TEI, which is our Truls Eye Institute. So I'll talk to you a little bit about those. So cardiology, obviously that's definitely going to be a more specialized one for people who are interested in the heart, or kind of looking for a challenge. This is definitely one of our busier clinics. They see a lot of different patients, as you can imagine. Nebraska Medicine has a lot of patients that come to it when, in the critical care setting, inpatient and everything, and then need to kind of do that plan of care after they, had a heart attack or something like that. So the cardiology clinic is very busy, but definitely kind of if you're looking to specialize in something that is, always changing and interesting, it's definitely a great one. Now, employee health. Now, this is kind of a fun one just because we don't see employee health openings a lot. The reason these ones are open is, as you can imagine, I don't know if you knew, but we had a pandemic going on right now. And our employee health, so they kind of have 2 aspects to their job. They talk with all of our new hires. So if you guys would join Nebraska Medicine, you would have an appointment at employee health for your post-offer assessment. So they see every single new person that we have come in. And then they also see our current staff too. So obviously, as I mentioned with COVID, there's been, people who are, trying to return from health or have questions about COVID. They're kind of our frontline staff for those questions and making sure they can get cleared back to work or any issues that they're having and things like that too. So they have been extremely busy during this time. And so these, I have 2 positions for employee health right now, are specifically open to, kind of help the volume of calls and patients that they've been seeing and things like that too. So employee health is, they work really close with talent acquisition, where my team is from and everything, just so we make sure that our new hires get cleared. So it's always fun to work with them because they're kind of on the HR side, but they're also on the nursing side. So it's kind of a fun collab. But people who are in employee health, this one specifically, they just have a lot of tenure on the team. So it's a lot of people who are in the position and they don't want to leave the position, which is good. I don't want to steer them in a different way, but it's a lot of people who enjoy it for sure. So they don't have a lot of openings kind of for that reason. So I'm excited to see some of these. And then the other one we have is at the Truls Eye Institute. So I'm not sure if you guys know where this one's specifically located, but it's technically on our main campus. It's just south a little bit by the Lauritzen Outpatient Center. And it's a beautiful building. So they just built it, I want to say probably within the last 5 years or so. I don't know if you guys have been in it yet, but it does connect. There's a bridge that connects through Lauritzen Outpatient Center, so you can get to it. It's all brand new, and it's definitely one of our fun clinics for that aspect. It's really pretty to work there, and they did a lot of things with different, I don't know, like the artwork and stuff is interesting just because it's all geared to like ophthalmology and stuff like that too. So in general, a clinic nurse position does go through some of those job duties that could be like, medication refill, scheduling, triaging patients, that type of stuff. I think one of my favorite aspects about the clinic nurse positions is just that you really get to build relationships with, you know, the staff members, but then of course the patients as well. So it's something that, you know, when you're inpatient, hopefully you're not seeing the same patients over and over again continuously, because that could mean that something's going on with that and wouldn't be good. But for clinics, obviously, you know, they're definitely more stable depending on what stage they're at and everything. And you really do get to build good relationships with them throughout the process and everything, just because they do have the clinic visits that they come in and check in every couple months or weeks or whatever. And, you know, you really get to build those strong relationships with patients and then watch them improve and everything too, which is, you know, satisfying. Now, some of the other positions that I recruit for that are still going to be in the ambulatory setting, kind of a blanket statement that in general, my positions are going to be, you know, Monday through Friday, 8 to 5, no weekends, no holidays. So that's kind of like, everyone loves those, not maybe everyone, but a lot of people love those hours. So that's definitely a pull for a lot of people, especially if you guys have been, you know, working inpatient for a lot of years or anything like that. I guess I should ask, let's talk about a little bit about you guys. What kind of background do you come from? Mary, do you want to start?
Sure. So I've been an RN for 16 years and started out in inpatient for about 11 years in inpatient. And then once I had kids and kind of started my family, I've moved into kind of the outpatient arena. And right now I'm working in, I work at in like a sort of like an immediate care clinic after hours, evenings and weekends. So that way I can be home with my kids during the day. And so kind of what you were talking about, the immediate care clinic there, that's pretty much what I'm doing right now with another company. And yeah, that's pretty much it.
Awesome. Perfect. Thank you for sharing. I probably should have started with that, but no, that's awesome. Thank you. Kayla, do you want to tell us a little bit?
Yeah, so I am a second career individual. I was a state trooper for the state of Nebraska for 6 years.
Really?
And I've been in nursing. Yeah, I've been in nursing for a little over 3 years now. I did my LPN and I'm an RN now, and I'm at UNMC finishing up my bachelor's.
Awesome.
And I primarily come from long-term care, assisted living, skilled nursing. And right now I'm currently actually working at a pharmacy, a long-term care pharmacy. So I'm doing something a little bit different in nursing as well.
Yeah.
But just looking maybe to get into a clinic, just kind of expand my knowledge and experience elsewhere.
Awesome. So I have to ask, so what made you make the transition, you know, from, you know, being an officer to nursing? Obviously you're helping people both ways and things like that, but just curious.
Yeah. So when you wake up in the morning and you just don't love going to work, I
can do it.
It's time for a change. And yeah. So, you know, I worked a lot of nights, weekends, holidays. I missed a lot of time with family, and it was just really hard to maintain a marriage when you're working opposite shifts.
Sure.
So I knew I had to get back into something to kind of make that work for the home life.
Perfect. Well, that makes sense. Well, good. Welcome to nursing. We're glad that you're here. I should also, so, you know, it's interesting. So how long were you an LPN for?
I was an LPN for about 2.5 years.
Okay. Perfect. No, just curious. We've had, I would say, so I just got our LPN desk within almost the last year that I've been recruiting for that. And it's been interesting just because I almost feel, I don't know if you guys agree, but LPNs are almost kind of like a dying breed. It seems like it's just that they're kind of a dime a dozen anymore. And I don't know, it just doesn't seem like as many people make it where they, you know, could go to the ADN route and then BSN and things like that too. So just kind of from a recruiting standpoint, I've had probably about 10 or 12 openings for LPNs, and they, you know, there's just not a lot of LPNs in general and things like that. So it's, I mean, I don't know, it's been kind of interesting that it's kind of been a struggle, I'll be honest, but yeah, so that's interesting. So, well, good. So just a couple different other positions that I always like to touch on. So of course, kind of like I mentioned, the bread and butter is definitely our clinic nurse positions. But then for someone who's kind of looking for, I don't want to say necessarily a challenge, but just maybe like a step up from a clinic nurse position. I have a couple different those. These ones are probably the ones I feel that I'm really passionate about, just because I like people who are, looking to grow in their career. And those are some of my favorite conversations to have with candidates and everything. So I'll kind of touch on these, but we have nursing care coordinator positions, clinical program coordinators, case managers, ambulatory supervisor, and then I do have a couple other staff nurse positions that we'll talk about that first. But so staff nurse positions are usually what kind of the other groups are doing right now in the inpatient setting. I have a few staff nurses that kind of fall under me, just because kind of the nature of the hours, and then it's not necessarily just inpatient. So I have staff nurse positions for our infusion center, for the treatment center. And then so they see probably about 70% of oncology. So a lot of different oncology types of patients. And then I have wound and ostomy. That's a staff nurse position. Now it can be very specialized. So either people seem to like love wounds or hate them. So it's kind of like a either or type of thing. But I just opened that position a couple days ago for a wound and ostomy position. And then the last one I have is going to be for apheresis. So another one that has a lot to do with oncology. So those 3 staff nurse positions fall under me. And then again, they're kind of around that Monday through Friday, 8 to 5 type of to hours and stuff like that too. So those are those ones. And then the positions I should talk a little bit about for kind of the growth and everything. So a nursing care coordinator position is one of my favorite positions to recruit for, just because it is kind of, like I mentioned, one of those positions that you would grow into. So usually those positions, I believe they require like 2 years of nursing experience to be qualified for the position and everything. But it's kind of a hybrid between a clinic nurse and a case manager. So you have some of those job duties that are going to be like the scheduling, medication refill, triage, that type of stuff. And then you have some of the job duties that a case manager has, where you're really working on the care coordination and working specifically with the patients and the providers and things like that in a more kind of one-on-one setting and things like that too. So that's definitely one of my favorite positions to recruit for. We have a nursing care coordinator position that's going to be our Midtown clinic, which is a primary care clinic close to main campus. And then I have a nursing care coordinator position that is for radiology right now as well. So this is a brand new nursing care coordinator position to that team. So they have never had a NCC, we call that for short, for radiology before. So they are, kind of looking for someone to bridge the gap in with some of the patients that they have, and having a little more like follow-up and hands-on with patients. So they just created this position for radiology. One of my other favorite positions to recruit for is our ambulatory supervisor positions. Again, so if you're noticing a trend, like I mentioned, people who are wanting to do growth in their career and everything is just something that I'm passionate about. So our ambulatory supervisor positions are something that is, newer within the last couple of years. We've taken a lot of like lead positions and we're transitioning them into supervisor positions. And really what that means is it's a lot more responsibility. So of course they did get compensated for more responsibility, but you actually have direct reports and you're like a step below the clinic manager. So this is a great position for someone who is, looking to, get into potentially management or some sort of leadership. It's a good like first type of position to get in there. You obviously do get, like I mentioned, work really closely with the clinic manager. You can focus on like the operations side, of course, but then like staff issues, that type of stuff too. But you usually, it depends on the clinic, but could have around like maybe 15 direct reports from there for those types of positions. And then lastly, we have our case manager position. So these are, I'm gonna say like, for me, they're definitely one of our high up positions in regards to compensation, just because of the nature of the work. A lot of the times the 2 that I have open right now are for oncology. So I have a full-time case manager position that is for surgical oncology, and then a PRN position that is just for oncology in general. So 2 of those right now. So those positions are exempt salaried positions. I believe they require 3 years of experience to be qualified for those. And then of course, you really do get to work specifically with the providers very closely to really talk about the plan of care with patients. And, I think that they really appreciate the feedback and, you know, kind of getting to grow in those positions too. So those are definitely great positions. The nursing care coordinator positions have been kind of taking over more of the case manager ones. So we definitely see more NCC positions more than we do case managers now, because we're looking for someone who can do the hybrid, like I mentioned. So can help out with some of the clinic duties as well, but then can also help and do more of the coordinating of care too. So that in general is all of our current openings right now. I know that was a ton of information to throw at you guys. Any questions on any of those or anything that you would like me to elaborate more on for our open positions?
Are there any open positions in any immediate care clinics?
So not right now for an RN. I do have an LPN position right now. Those positions do come open. I won't say like very often, but they do come open. So those ones are I usually try to, so we got 10 minutes left. So those ones are listed here for, you'll say like clinic nurse - ICC or immediate care clinics too. So none right now, but definitely keep out a look for those. Are you specifically, Mary, looking for kind of the after hour, like you mentioned, where you're currently working now, that type of thing?
Yeah, yes.
Perfect. I should reach out and see, because we have, I think, 2 LPN positions right now. And as mentioned, we've been having a hard time filling those LPN positions. So
Right.
it's something that I could definitely ask about if, you know, instead of an LPN, they could maybe utilize an RN to a higher extent.
Right.
So I can definitely ask
Great.
for that. So perfect.
Great.
What about you, Kayla? Do you have any specific questions or anything like that about what's open?
Not specifically, but I do appreciate the in-depth
There's a lot of information.
conversations had with all the different, with the different opportunities. I have looked on your website, and there is a vast array of things posted. So just having a little bit more knowledge on what those do day to day is really great. So thank you for that.
Perfect. Well, good. So I'll talk a little bit. So like we said, we have about a little less than 10 minutes. So I want to touch on like the growth of those types of positions and then benefits. So I'll talk a little bit about pay and kind of what to expect for those as well. So how I was listing them. So I guess you could technically say clinic nurse, staff nurse, nursing care coordinator, ambulatory supervisor, case manager. That's kind of like the growth ladder in the ambulatory setting, I suppose you could say. So I don't want to say clinic nurse is necessarily entry level, because a lot of our clinic nurse positions do want to see people who have you know, lots of years of experience and just the critical thinking skills really. A lot of the times our clinics don't, I wouldn't say encourage new grads to apply, just because they just don't have that critical thinking just yet and things like that too. So they're definitely kind of geared to, you know, experienced nurses, I suppose you could say, is a lot of the people who apply, or kind of like Mary said. So I talk to a lot of people who are, you know, wanting better hours for family life, or, you know, just the schedule in general, that type of thing, or people who have worked inpatient for 20 years and need a break from it, that type of thing too. In regards to, so we'll talk a little bit about pay. So clinic nurse position, I guess blanket statement again, any job at Nebraska Medicine is going to be individualized to the person. So clinic nurse doesn't just make X amount across the board. It does go off of your years of experience and then your education, of course. So those are the 2 different factors. Now I think, let me look here. So a clinic nurse position, so if we did hire like a new grad in that role, it would start around $24.50 and then increases there with years of experience. So that's for a new grad. And then, so obviously, like I said, it increases with years of experience. Now, a clinic nurse position is going to be a pay grade lower than what a staff nurse position would be. So I mentioned some of our staff nurse positions that I also recruit for as well. Those are going to be 1 pay grade higher. Again, in general, with staff nurse positions, it focuses more on like the acuity of the patients. And then, of course, they do work some different hours, with a lot of them are like the 312s and things like that too. So they are compensated slightly higher for that. A nursing care coordinator position is actually, it'll be a pay grade higher than a staff nurse. So 2 pay grades above a clinic nurse position. It's an exempt position. Again, it's going to be that Monday through Friday, 8 to 5. type of position as well. And then that is the same pay grade for an ambulatory supervisor as well. So would be, again, 2 pay grades above a clinic nurse position. So some of these positions would start at salaried, but I guess if I was going hourly, again, minimum starts out at like $29.71 and then increases there with years of experience for an NCC and an ambulatory supervisor. And then case managers. So as I mentioned, case managers are kind of those, it's not the highest type of position, obviously, that you could be as an RN by any means. Of course, you can go into leadership or be a clinic manager, that type of stuff. But for positions I see a lot of, that's kind of what I'm more referring to. So a case manager position, not that this makes sense to you guys, but it's pay grade 64. So clinic nurse is a 61. So it's going to be 3 pay grades above what a clinic nurse position would be too. And again, that's going to be another exempt salaried position as well. So you obviously a little bit higher pay than a clinic nurse position for that. Any questions about pay? I know that's kind of a lot to take into, but anything that you have more specific questions on, anything?
Are all of these types of positions, like the NCC, case manager, those positions you're talking about, are those all full-time?
Yes. So
Okay.
the majority of them will be full-time. I have one case manager position that's PRN right now, but that's a good question. So in general, I hardly ever see PRN positions except if they're in the immediate care clinic. So that's kind of the exception for that. And then really, I mean, PRN, it's just, I don't really have any like float nurses within the clinic setting just because they're also specialized in, you can operate clinics differently and stuff like that. So we don't really see float of those. Part-time is definitely more common than PRN, but most in general are all going to be 1.0 FTEs usually, which is that 8 hours every 2 weeks for that. So we'll occasionally have a clinic nurse position. I just had a clinic nurse and a case manager position a few weeks ago that we just filled that were like a 0.6 and a 0.5. So it does happen sometimes. I do obviously mark that on our website. You'll be able to see which ones are part-time or PRN on there too. But yeah, good question. Thank you. Other than that, let's see. So I think, did it say 5 minutes? Did that come across yet or not yet? Did you guys see? Okay, I don't know if it shows on your screen or not, but it gives me like a little like warning.
I saw the 10-minute, but I didn't see anything else.
Okay, so let's see. We are in here, okay, till 35. So lastly, I'll just go ahead and touch a little bit on our benefits, and then I will open it up to questions more specific if you guys have some. So a little bit about our benefits. We do offer 3 different healthcare plans that you can choose from for health insurance. And then we also offer dental and then vision insurance as well. For PTO, you'll start accruing 6.15 hours of PTO per pay period for paid time off that you can utilize. So that is about 20 days per year, just to give you a heads up about that. And then it does, you start accruing it right away. So I always think that's a nice feature. I've worked with companies before where you have to wait like 3 weeks or 3 months or something before you can start accruing. So you start accruing that right away, which I think is nice. And then we also have our retirement plan with employer match that is going to be through Prudential. And then it's a 403B retirement account for that. And then just some of our other things I always like to mention. So I know Sue mentioned that Sue and Chanda, I think both mentioned that our tuition reimbursement. So we do have that available if you guys are ever interested in going back to school, or I also, like I mentioned, I recruit for our APP. So if a nurse practitioner career is in your future, hanging along with me and we can be friends for a couple of years while you're going back to school. And then we have an employee assistance program. So this is has to do with like counseling services and things like that they offer for both the employee and then the family members too. So I think that's really nice if you've had like something traumatic that's happened or something like that where it's affecting you, but it's also affecting your family. They have that. This came into effect a lot last year when we had, a little bit before this time, but when we had all the floods that were going on, we had a lot of people reaching out about like, how can I help other employees and things like that. And I thought it was really nice just to see all these people who are wanting to help other employees and things like that. So they'll do some things like that through the employee assistance program. And then We also have our Empower for Wellbeing is another one I just like to touch on. It does have free access to a fitness center that's at Nebraska Medicine in one of the basements, and then they do free training sessions as well. So if you have like specific goals in mind or something like that, we have a trainer there who can help with your fitness goals too. So that in general is just some of our benefits. Do you guys have any questions over benefits?
In
No.
regards to the tuition reimbursement,
Mhm.
do you have any more details on that? Like, is there an
Yes.
amount? Is there a commitment, like a contract
Yeah,
of how
that's a
long
great
you need to
question.
work?
Yep. So basically here, I'll go kind of through the nitty gritty details for you here. So you do have to work for us for at least 6 months. And then after that, for a full-time employee, for each year, you're eligible to up to $5,000 for tuition assistance. And then it's a lifetime maximum of $20,000. And then
Okay.
it's not a contract per se, kind of like you mentioned, but it does require 1 year retention for each tuition assistance payment, if that makes sense.
Okay.
Yeah. All right. Okay, that actually, we wrapped up before. So good. Well, thank you guys so much for chatting with me today. I really appreciate it. We'll talk a little more about applying in this next session here, but thank you so much. I appreciate it.
Welcome back, everyone. I hope you enjoyed your second breakout session. These are going by so quickly. Shonda, I did give you a name for the second Amazon gift card.
Yes, you did.
You ready?
I'm ready. So our second winner, and I apologize if I mispronounce your name. I can relate because it happens. Kaya Condon is our next winner. Yay.
Yes, yay. Kaya, are you still on? Well, either way, we will email you early next week with that Amazon gift card. So thanks for joining us, and thank you for announcing that, Shonda. That was very nice of you.
Congratulations, Kaya.
Okay, so at this point, we're just going to go through a real quick wrap up. And like I mentioned, if you are an experienced nurse and the new grad residency might not apply to you, you can definitely feel free to jump off after this. But before you go, if you just want to put in the chat what your favorite thing was about today and how excited you are to learn even more about Nebraska medicine. Also in the chat, I guess my email address is up here on the screen. I was going to type it in the chat, but if you leave today and you had some questions that you didn't quite get answered, please feel free to email me. I would be more than happy to help you out. If you're ready to apply, nebraskamed.com/careers is where you will be able to find all of our openings. I will say that positions come and go on a daily basis, constantly getting new recs approved as old recs are filling. So if you really have a position in mind that you're hoping for, you don't see it even today when you look, feel free to check back in a couple of days or, ask me about other positions that might be more similar, and we can get something figured out for you. We have plenty of openings right now, and we would love to have you join our team. If you are a new grad, I normally encourage new grads to start applying about 6 months out from graduation. So if you're a December grad, absolutely in that time frame, feel free to start applying now. If you graduate in May, get through the holidays, and then even at the start of the new year would be a great time for you to really start putting your applications out there. It's really nice to kind of have that interview process and job kind of off of your plate as you're finishing that last semester of nursing school and going through finals and boards and all that stuff. So definitely feel free to put yourself out there, apply to a couple different areas and see how it goes. But I want to thank you all for joining us today. This has been a great event for our first virtual. So much can go wrong with technology, but it seemed to be pretty smooth. So I really appreciate you all being here and spending your Saturday morning with us. So like I said, feel free to shoot me an email with any questions that you have. Otherwise, I can't wait to see you at new colleague orientation as our new colleagues here at Nebraska Medicine. So with that, I am going to give it over to Kaylee Guinan, and she is going to chat about the nurse residency program.
Hi, everyone. My name's Kaylee Guinan, and I have been a nurse at Nebraska Medicine for 23 years. Essentially, I started as a new grad and never left. I worked at geriatric rehab. Back then, we actually had a SNF that was part of the organization, and I worked there long enough to know I absolutely did not want a career in geriatric rehab. And so I transferred as soon as I was able to 5 West. And I worked on 5 West for 7 years, and that's where we say I grew up. I grew up on 5 West. 5 West and a lot of the other med-surg floors are fabulous because you see so many things, and it really gave me a rock solid foundation for the rest of my career. 5 West split into 5 West and CPCU. And when that split occurred, I went to the CPCU side and I worked there for another 7 years as a nurse, a team leader, and an educator. I have worked every shift, every FTE, and in quite a few roles. And at the time I had little kids and I was very tired from working nights. And so I moved to employee development. And I worked in employee development, and that transitions to nursing professional practice and development into my current position. And I am right now the manager of the nursing professional development specialist. I am also the nurse residency program coordinator, and I kind of have my hands in a lot of things that are nursing education related, whether that